Hi, I'm Dr. BillDean. I'm an allopathic doctor with the Ayurvedic department at Bastyr, and we'd like to share with you what we know so far about the current status of the COVID-19 infection. As you know, this has interrupted many different social meetings and engagements, in particular our Ayurvedic fair that we were going to offer. And so we thought we would use some of the concepts that Ayurveda offers with respect to helping us prepare for infections like the viral infections and the COVID-19 infection. We're learning now over the weeks of dealing with the COVID-19 global pandemic that the virus is not only a highly contagious, but more so than the regular flu virus that we've encountered in the past, but that with every 3 to 4 rounds of transmission, there develops subtle mutations within the genetic material of the virus. This means that our immune system, it has to be highly adaptive to the virus because it subtly is not the same infection as it was 3 weeks prior. And in contrast to the regular flu virus, the COVID-19 virus is much more deadly, particularly for those in the population who are at higher risk that we'll talk about in a minute. There will be no vaccine for 12 to 18 months to help prevent the spread of this viral particle. And since there is no treatment for viral infections except respiratory support, our only real medical treatment is our own individual prevention plan. And that's what we would like to address today. Now, Ayurveda is a star in the medical disciplines when it comes to prevention and preventative care. And it offers many different ways in improving our personal physiological strength to resist disease like this infection. Our current medical discipline can be greatly enhanced by the Ayurvedic principles that we'll talk about that can be taken up by the general public that go far beyond hand washing and social distancing. So it behooves each and every one of us to begin to adopt strategies that we can take from Ayurveda to build our own personal resistance. So let's get to it and talk about some various things that we can do. Now, what we know so far is that this is like a flu infection, except more severe, and that it produces sinus congestion that can progress to the lungs. It can spread to each other by respiratory droplets from the infected person. The incubation period is around 5 to 6 days. People can be asymptomatic and be carriers of the virus. This is very important. In the past, what we thought are that the viral cold that we encounter on occasion during winter months is actually spread when the person is actively symptomatic. But that really isn't the case in this particular situation. And so we don't have to be sick to give the virus to another person. And there really is no treatment except respiratory support, as we've talked about in the past. So who are at risk? Elderly people who are above 70 years of age and who have respiratory conditions such as COPD, or people who are heavy smokers. Elderly people are clearly at risk because they're primarily sedentary and they have other multiple health conditions such as diabetes, insulin dependent, known immune deficiencies like cancer therapy. Obesity is a problem as well, and I think we're seeing that as an aspect in the Italian population. any person with compromised lung function, be it from asthma or bronchitis, is at risk. And any person with known or unknown congestion, like many of us who live in the Pacific Northwest. And why is that? It's because in our cold, damp climate that we live in, these are factors that invoke an imbalance in our physiology that is crafted from the characteristics of mucus production. And if you have a lot of mucus, whether you know it or not, that mucus will trap viral particles. And when it traps viral particles, then we're more susceptible to being either infected or a carrier. So some of what we'll talk about is how to avoid this mucus production that clearly occurs during the winter months for people in the Pacific Northwest. Now, how to protect yourself from getting infected or becoming an asymptomatic carrier. There are primarily two steps that can minimize the chances of a COVID-19 infection. One is, as we talked about just briefly, reducing respiratory congestion, either in the nasopharyngeal area, as diagrammed here, or in the lungs themselves. And we'll talk about how to do that. We can also enhance the immune system. And so these two areas are specific areas that we can help ourselves and do a preventative plan and put it in place in our lifestyles. Now, clinical congestion, many of us don't know we have congestion in the upper nasal passages, because when this energy of mucus becomes present in the physiology, it becomes static. It stops moving. And so when we're walking around in day-to-day activities, we don't even realize we have this static mucus being present. But when and that static mucus can also be present in the lungs themselves. So what can we do about this congestion in the upper airways or even in the lungs themselves? Well, the first thing we can do is use neti. And I would not use an irrigator. I know they're popular, but irrigators really produce too much pressure and may actually push organisms into the sinus cavities themselves. And so if you see the handout that's attached with this video, you'll be able to understand what we're talking about. Pranayama is also another very valuable technique because it helps clear mucus, it helps move mucus out of the pathways, the upper respiratory pathways, and it also is very, very useful in terms of improving our digestive power or our strength, because it actually affects core musculature. And core musculature and digestive power are actually, in Ayurveda, one and the same. And also we can do nasya, because nasya itself, as a very powerful technique in Ayurveda, can be very useful in moving mucus, particularly if it's the correct mucus or correct type of nasya, which we'll talk about in the handout. Now, you can see from our handout or from our diagrams here that actually this mucus, represented by a K, can be very impactful in the sinuses. But after neti, what happens is that mucus gets cleared. Now, the other thing we can do, and that we've talked about, is boosting the immune system. And in the beginning of the handout that you'll see, there are some basic lifestyle techniques to help improve our digestive power. which improves our immunity. So paying attention to the appetite and how you feel after eating can really give you an understanding, just a very good overall glimpse of what your strength is with respect to this digestive power. 70% of the immune system resides in the gut and its microbiome, or the bacteria that you've heard about that live in our gut. It's said that we have 3 times as many bacteria in our gut than we have cells in the body, which means that we have a tremendous number of organisms there that need to be working on our behalf, because they're there for a very important reason: to improve our digestion, to improve the absorption and assimilation of foods, and to also enhance the immune system and our health. So there are three ways to improve the microbiome or bacteria of the gut. First is with prebiotics, such as tapioca or taro root, and you can see these on our handout. The second is using probiotics. There is a basic, what I consider the trifecta of probiotics, and you can read about that in our attachment. And lastly, homemade yogurt, which taken as a lassi can be very, very effective in terms of helping populate the bacteria in the gut with good guys rather than bad guys. So we've talked about now 2 different ways to help enhance a protection plan for us to be able to strengthen our resistance so that we don't get infected. And these 2 happen to be reducing respiratory congestion, as we talked about, and you can read about in the handout, and the second is to enhance our immune system. If you have any questions about these handouts, you can feel free to email me at drbilldean@gmail.com. That's Dr. BillDean, drbilldean @gmail.com, and I can answer some of your questions. Okay, well, thanks very much for your attention, and all the best in preventing this virus from infecting you. Take care.